Hello, thank you for joining me for my series Q and Alice. Today is a question from Endo Flower. She asked, how and when would you test for perimenopause? Well, thank you, Endo Flower, for that question. So it would be fun to talk about it for a few minutes today. So perimenopause is the time between when ovaries are functioning normally, giving off an egg or ovulating every month, and when the ovaries stop functioning, stop releasing eggs, and periods stopped for more than 12 months. So ovaries do not just turn off like a switch. There seems to be a transition where the ovaries starts to run out of puff. Their previously regular rhythm starts to become disrupted, and then they stop. And that transition is called perimenopause. Now, the average duration of this transition is about 4 years, but some women will go through perimenopause much sooner, and some women will take longer. There is no universal test that we can diagnose perimenopause. There are clues, especially if you fit the typical pattern. So typical pattern is that onset of perimenopause is around 47 years old, but we would accept earlier onset after 45 years old as normal. The next clue is your periods. Periods usually will go from regular monthly to longer cycles. As the cycles lengthen out, many women will experience perimenopausal symptoms like hot flushes. Some will experience sleep disturbances or bladder disturbances, like needing to go to the toilet more frequently. Other typical clues will be a rise in hormone tests done early in the period cycle, including the FSH and the LH. Other tests that also can help identify perimenopause are tests that indicate the ovaries are running out of eggs, such as blood tests to test for egg quantity, including AMH or anti-Müllerian hormone blood test, or an ultrasound to count the follicles on the ovaries that represent the egg reserve in the ovaries. So these are tests that can give you a clue that someone is experiencing perimenopause. But the difficulty here is that not everyone experiences perimenopause the same. Everyone is a slightly different individual. These tests are very helpful if someone experiences perimenopause in a typical pattern. But many women experience perimenopause differently. They can go through perimenopause within a few months. And in some women, they can last up to 5 years. Some women's hormones in the early phases of their period do not elevate. Some women will have abnormal hormones even before they begin perimenopause. So there is no hard and fast rule as to when would you test for perimenopause. The average age of onset is 47 years old, but we would accept after 45. If a woman experiences perimenopause before 45 years old, I think it is worthwhile to test them, because it's important to find out if it is just early perimenopause or is there another hormonal or other endocrine problems associated with other hormones such as thyroid or prolactin. If a woman experiences perimenopause after 45 years old, and especially if she displays other typical signs or symptoms of perimenopause, then testing will be less important, because perimenopause can be a natural process and there's no specific treatment that we could give to stop it from happening. If, on the other hand, a woman is experiencing distressing symptoms while they're undergoing perimenopause, such as hot flushes or bladder disturbance, sleep disturbance, etc., then treatment of those symptoms should be considered. Because even though we can't stop perimenopause, it is not reasonable to expect a woman to give up their quality of life while they're undergoing perimenopause. So there are many symptomatic treatments that we can offer to help someone through their perimenopause process. And there should be a very low threshold to test for other things, such as thyroid disease, for example, if there are other non-typical symptoms when someone's experiencing perimenopause. So I hope that answers your question, Endo Flower, and thank you very much for sending that through to me. and thank you for listening. If you like my Q&A series, I would love to hear from you with your questions. So look out for my Instagram stories on weekends with Q boxes where you can send me your questions. Bye!